Welcome to the Gilman-Woolsey podcast. This is episode number 8. Today we are talking with David Larav, who is Israeli, and he has family over in Israel and has been in very close contact with them. And we are discussing the state over in Israel, similarities between Israel and the United States, and then we discuss business and some of the implications for the current business atmosphere and going forward in the future. I hope you enjoy it. Hello, welcome, David. Can you tell us a little bit about yourself and your background?
Hey, Gilman. Sure. So I'm originally from Israel. Have been living in the States for the last 10 years, on and off. Somewhat location independent in the last few years, although as we well know, the reality has changed a little bit there in terms of travel and going abroad. I think you even mentioned you had a trip to Ireland or something like that.
Yeah, we're supposed to be in Ireland right now. We were supposed to be there from the 14th to the 23rd, and literally like 2 days before, we're like, this is not looking good. We've got to cancel this.
Yep.
So what are you hearing from your friends and family that still live over in Israel? What are the policies that they're putting in place today, and what have they done differently than you've seen here in the United States?
Yeah, so I think what's been fascinating with Israel is the speed at which the government has decided to take measures to contain the virus. So they've been on pretty much complete lockdown. So a lockdown that you would see without cops patrolling the streets or anything like that, but instructing people to stay at home, canceling work, school, all of those things that you would normally do on a day-to-day basis, and really going to containment very early on. They also have been one of the first countries to issue travel bans when things were just starting up in Europe. Mm-hmm. So it's been really interesting to follow how things are going in Israel and trying to model that as a best case scenario, assuming that in the States, we continue to wake up to this and take the right measures that are proactive.
Right. And from what I've seen, it appears that they completely shut down their border and they're quarantining 100% of people, regardless of where you're coming from, coming back into the country. Is that correct?
That is correct. Whether you're a citizen or if you're a tourist, you have to be on 14 days quarantine.
Yeah. And what is the testing situation over there? Do you have any idea? Are tests widely available, or is it primarily quarantine, watch and wait at this point?
As far as I understand, the tests there are pretty available. I just heard that they got 100,000 tests or something like that from an unknown country in the Gulf Coast or the Middle East, I guess. So it doesn't sound like they're having shortages of testing there like we have here in the States, unfortunately.
Yeah. How big is Israel? I mean, population-wise, do you know?
Population-wise, it's about 8 million people.
So a tiny fraction of the United States. So even 100,000 tests would be a pretty sizable amount of tests compared to what, I mean, we don't even have 100,000 tests done here to date from what I understand. So.
Yeah. I just heard today that there is a company that's launching private testing starting on Monday in the States. Mm-hmm. Have you heard about that at all?
Private testing as far as, you mean diagnostic testing to see who has the virus?
So they will be sending you a home kit that you then send back to them, and then you need to pay for it. I think the price is around $125.
Yeah. You know, I did see something on that. I'm a little skeptical of that, and I'll tell you why. Because as a medical professional, I've done some of these samplings before. So the first one is we do what's called an oropharyngeal swab. And basically, you have to stick what's the equivalent of a large Q-tip all the way to the back of your throat, past the little dangly thing, all the way to the back wall of your throat, and take a sample back there. The second one is what we call a nasopharyngeal swab, where you actually stick a Q-tip all the way through your nose, all the way to the very back till it stops. And you take a sample.
Both of them are really fun.
Yeah, they're and I mean the thing is like even in medical school when we were trying to do this, like you were doing this on your friends, and it was hard to do it because you develop kind of a callousness. I hate to say it, but like when you're a doctor long enough, you get used to doing uncomfortable things to people that are
Hmm.
not socially acceptable. And so, you just kind of get used to it. But like trying to do it to yourself or a family member or a friend, I think there's going to be a lot of false negatives that come out of that, but we'll see. We'll have to find out.
Hmm. Hmm.
So, but
Yeah. So,
I think
mhm.
the bigger hope, honestly, is these drive-through testing solutions that they have, because it's kind of the best of both worlds. You can get it done relatively quickly. You know, we can set these up all over the place, but you actually have someone that's trained in getting good specimens to sample people. But I don't know. I mean, I'm curious to see every model. I'll be curious to see what they find as far as how many are adequate samples to be able to do diagnosis.
Hmm. Hmm.
So one of the things I wanted to ask you about that I was really curious about, I'm very into technology, and I had seen reports that over in Israel, they were basically using metadata from cell phones to determine who was around who. And then they were actually contacting people that had come into contact with someone that later proved positive to coronavirus, and basically saying, we have data, you were around someone that had coronavirus, you need to go get tested, etc. How have you heard anything about that, and how receptive are people to something like that, which seems like a horrible invasion of privacy, at least here in the US?
Yeah, yeah. So I don't have any official confirmation of that. What I do know is that there has been authorization for the Israeli equivalent of the FBI to use all of their capabilities to help with the corona. Um, and I know at least one application of this that has been confirmed is to help and enforce quarantine.
Mm-hmm.
So if somebody who's in quarantine, like you mentioned, for example, their cell phone GPS is showing that they're out of quarantine, they could have access to that, and it's been approved by the government. Of course, they're trying to enforce it in the most. I think they even have some provisions there that say that if information collected on you can't be used on criminal cases or anything like that. But they're definitely trying to use it. And as far as I know, the Israeli public isn't too concerned with this.
Yeah. And this, looking at both China, even though people don't like to use China as a good example, I hate to say it, in this one instance, China's response to this particular thing and the way that they were able to enforce it probably, I mean, time will tell, but probably limited at least the scope for now. I'm concerned that it'll bloom again over there, because it only takes one person to start the chain, and it can take several weeks for it to
Mm-hmm.
completely show up. Uh,
Mm-hmm.
but one of the things both China and South Korea has done very extensively is what we call contact tracing. And basically, the thing that I find interesting about the Israel approach is basically it's automated digital contact tracing. And, I would hate to see something like that implemented in the US, because our government here doesn't have a good track record of limiting things. Once they have a tool, they seem to go, out of control with it. But
Mm-hmm.
certainly, you know, maybe some private company or maybe someone out there that is one step or two steps removed from the government, maybe that's a solution that maybe we could consider if things got bad enough. But if the cat gets far enough out of the bag, I don't know that we can put it back in, even with extensive contact tracing.
Sure,
So,
sure. And I think the most important thing here with whatever method or tool you try to use it that has been done successfully in Israel, say, okay, now we have a corona, someone diagnosed with corona, let's try and trace everybody that he's been in contact with and get to them and get them in quarantine proactively, even before they test, in order to prevent the spreading.
right.
So having I think they call it a chain of infection or some equivalent to that.
Yeah, like a transmission chain. Or
Exactly.
something like that. Yeah. And like
Hmm.
over in China, for instance, to give an example, and like I said, I don't love to like laud the Chinese government, but they had 1,800 teams of 5 people that were doing nothing but around the clock contact tracing, to give people kind of an idea of how like extensive and how organized they were in their efforts to eradicate this disease. This is one of the things. I mean, some people think I'm a little bit alarmist, but I'm just looking at Italy and I'm looking at Spain and I'm looking at France and I'm like, guys, we are more like them than like China. I hate to say it, but our outcome probably is going to be more similar to them than China, because China can just go in and they can sweep, under the rug, 100,000 people, and they've done it before and people don't think anything of it. Here in the US, people, would be in an uproar, rightfully so. But for something like this, like trying to contain a virus like this, I mean, the Chinese have a definite upper hand in not having to respect, or not having to, but just not respecting human rights compared to the United States. So, but
absolutely. And if we're talking about Israel here, I think it's an interesting mix between the two, because Israel is more towards the democratic than totalitarian compared to China, but it's definitely more strict than the U.S. And so with Israel, what we're seeing is that even when you take all of these proactive measures that go short of, sending police and the military out to the streets to actually enforce it, we still see cases rising. Just the curve has been flattened, and it's going by tens of cases every day versus continuing exponentially. I think in Israel now they have around 430 cases or something like that.
Right. And just out of curiosity, how would you describe the healthcare system? What do you think is better? What do you think is worse? Or how, the similarities and differences between there and here in the United States?
In Israel, in general, the healthcare system is more towards the socialist way. However, because it's a small country, they've been able to do it to the standards of healthcare that we're seeing in Europe and in the States. So the healthcare in Israel is considered very good, and it's practically free. When we say free, it's not really free. You just pay for it from your payroll taxes. It's about 10% of your gross wages go out to that.
I see. But as far as far as like the level of sophistication, the type of procedures, the number of physicians, the type of care you can receive over there, you would say is equivalent. It's more the payment structure and availability.
Yeah, exactly.
Yeah. I mean, this is kind of an aside, but going through medical school, I had a lot of very smart Jewish friends. So I kind of have like this image in my mind of a lot of really smart doctors over in Israel, taking care of people over there. So, but what business are you in? What's your interest outside of Israel?
So I own a couple of businesses. One of them is a locksmith company here in Colorado, or a portfolio of locksmith companies. And then also have a location-independent digital marketing agency. And
what type of hit have you seen thus far to your businesses, and what are you anticipating going forward in the coming months?
Yeah, so with the locksmith company, we've seen about a 50% decrease from pre-corona activity. And then we really don't know what to expect. However, we can only know that if things continue in the trajectory that they're going so far, we are preparing for additional decrease of revenue and activity.
And do you have employees?
Yeah.
Have you had to make any changes to your staffing so far as a result of this? Cut back hours, or actually had to let people go?
Yeah. So at the beginning of this week, when we saw the slowdown happen and realizing that this is going to continue and very likely get worse, we brainstormed all together and came up with some measures that include cutting hours. We were about to hire a few new people, so we had to freeze that. And then also with our office, we sent everybody home, and we have people working from home there as well.
So the people that are working from home, what are they doing versus what they were doing before? I mean, I don't know that industry very well, so it's hard for me to imagine how a locksmith could work from home. But
yeah, no, it's our dispatchers that are working from home. So they're the ones who are answering the calls and working with the technicians Um, and yeah, and they're able to do that from home as well when we have decreased activity.
Yeah. Yeah. We've even our business in Vietnam, we've seen some, excuse me, changes there, but it's kind of in the opposite direction. The problem that we've actually been having is that companies have been coming in and they've been offering what in Vietnam is absolutely ridiculous wages. I mean, for instance, like a beginning programmer that was joining our company, we were paying, on the order of say $300, $400, $500 for that equivalent
Mm-hmm.
programmer. There's actually companies from the United States and other places that have actually come in and they're offering people $3,000 for a junior level programmer, $5,000 for a senior level programmer. And I think that I don't know if it's that they're trying to diversify away from China, or just that because of what happened in China, that some of their workforce was impacted and they thought
Mm-hmm.
that, they just needed to get on the ball. But it's been the last month in particular has been, a little bit of a struggle. We've lost about 35% of our workforce being mopped up by other companies. And
Wow.
yeah, it's something we're dealing with literally on a daily basis. And, thus far we've been able to weather it. But it'll be interesting to see where it goes going forward. I'm hoping once China comes back online that, maybe, some of that will, go away and there won't be so much, pressure on the labor market. But at the
Mm-hmm.
same time, it's kind of a double-edged sword because I mean, these people are my friends and I really like to see them get ahead financially at the same time. So,
Mm-hmm.
and
Have you seen any other impacts in terms of clients
well, we had
and other activities?
several, we did have several possible projects in the pipeline. And what I have noticed is everyone has taken a very guarded stance. And I'm sure this is the same for a lot of people that are doing B2B right now, is that people are afraid to spend money to do anything outside of their normal scope because they don't know what's going to happen a month from now or 6 months from now. And that
Mm-hmm.
sense of fear, leads people to not be able to. And I'm sure that's impacted your digital marketing business as well,
Mm-hmm.
hasn't it?
Yeah, yeah, absolutely. In many ways, what's non-essential is either being cut or put on hold, which I think is the right thing to do at this time for any business, really.
Yeah. Something we've been thinking and talking about a whole lot lately is what the permanent impact I mean, because eventually we're going to get over this. We don't know when it
Mm-hmm.
is. We don't know how many lives are going to be lost, unfortunately, but eventually we're going to come out of this. And what do you see as far as the permanent impacts on the way that people do business? We've been talking a lot about like education and whether the university structure will be flipped on its head because people realize they can get educated, without going into the university. We can do it a lot cheaper and people don't have to go into massive amounts of debt. What are your thoughts on that, just out of curiosity?
I think we're going to see a large spike in both education and also work from home, education online and work from home. I'm guessing that a lot of companies are going to see that their productivity isn't necessarily going to go down when they have people working from home. And when things go back to normal, they could have a lot of savings from having less office space, and enjoying a lot of the benefits of people working from home and having remote work teams, which I know that you have with your company. So we've essentially been on this track for a while now, but I think a lot of traditional businesses are going to find that there are a lot of benefits to that.
Yeah, for me personally, there's two sides of it because I have my company that I have over in Vietnam that I work with. I
Mm-hmm.
also have I still am actively engaged in medicine. I work about 120 days a year, still in medicine at this point in time. But it's interesting because I live in Scottsdale, Arizona. I actually work predominantly out of Reno, Nevada. And, I've talked to them several times over the years. I'm like, if you set me, I mean, I do digital imaging, so I could do it in theory anywhere. And there's lots of people that are, but I've been like, set me up with a workstation, set me up with a workstation, set me up with a workstation. And, they were just dragging their feet, dragging their feet. And then literally on March, let me see, when was it? Like right at the junction between February and March, I actually approached them and I said, look, I know what's coming down the line because we're seeing it in other countries. I don't know when it's coming here, but we're going to be in a critical state here very, very soon. And, get me a workstation at home right now. And they started dragging their feet. And just this week, I get an email and they're like, we're procuring the equipment. We're going to get you a workstation at home because, they realize that, it's going to happen. But once I get the workstation at home, my real hope is that I can be like, hey, I've been doing this for 6 months successfully here. Let me just keep doing it this way. And I'm sure that a lot of people are going to kind of see the same thing.
Absolutely. I love to hear that even with hospitals, there is openness to this sort of innovation, and that it's finally happening. Will definitely also make your life easier, not having to commute.
Yeah, for sure. And the other interesting thing, and I'm sure that this is going to happen in a lot of industries as well. In medicine right now, we're getting a tremendous amount of deregulation, and a certain amount of regulation is certainly necessary. But like, if you're capable of being licensed in one state, say that I'm good enough to work in Arizona, there's no rational reason that I couldn't work in Texas or Nevada or Utah or anywhere else. But historically, every time you get licensed in a new state, it's a very rigorous process that takes months, sometimes up to a year to complete.
Yeah.
And now they're getting rid of that because they're like, we just need medical help. If you're capable, if you're licensed in one state, basically contact the governor. I mean, I don't know how this is going to work exactly because I'm hearing it out of the mouth of Trump. And announcement versus practice, as sometimes is a little bit different. But at least the messaging that we're getting is that they're going to make it very easy for us to work between states. And we'll see if that carries on into the future, if they clamp back down after this is over or not.
Mm-hmm. And it's very interesting to see this happening on something like healthcare. And actually, if we compare it to the crisis that we had in 2008, the impact was the opposite. Because the problem was financial regulation, and that was viewed as the problem, then the institution came in and said, okay, now we need a lot more regulation in order to prevent this from happening. Now we're actually seeing an opposite force coming in saying regulation is preventing us from responding to this. Well, let's remove it.
Yeah, and I think the thing is regulation brings stability, but it kills innovation. Like it prevents people from figuring out unique and different ways of providing things for cheaper and more, you make it more widely available. And that's why, I think that's why in medicine in particular, you're seeing that is because right now, the consistency is somewhat less important than the availability. And so they're making the changes that are necessary to make it so that we can get the help where we need it when we need it. Because certainly it's going to be a dynamic situation. It's going to be hot spots in the country that have tremendous needs that may cool off, and then other places, and we may have to shift, personnel and resources around to try to meet the demand where the demand is at. So
yeah, what about the one thing I've been hearing a lot in Italy is that a big reason why the percentages of mortality from corona are much higher than other places is due to lack of critical health equipment for oxygen and lung bypassing and so on. How are we in the States in terms of preparedness for that?
My assessment is that we're pretty critically underprepared for that. And, this morning, I've been listening to the task force every morning, and Trump was talking about, being able to bring online, new ventilators. Well, bringing new ventilators online, you can't just repurpose something else. But I think what he's probably talking about, and we'll see what comes out in the days and weeks ahead, but I think they're talking about CPAP and BiPAP machines, because the most simple version of providing oxygen to someone is putting basically what we call a nasal cannula, which you've seen is like the tubes in people's nose. People that have a difficult time maintaining oxygen on that, what you can do is you can give positive pressure breathing, like with a CPAP or a BiPAP. And that's the thing that you see people's nose that they sleep with. Well, if you combine that and you infuse oxygen into that instead of room air, you should be able to allow some people to survive on that type of method, and then save the innovation where you actually put the breathing tube in for the most critical cases. And that's my guess what we're trying to do at this point in time. But estimates that we've seen right now, for instance, New York, I think they said had like 3,500 critical beds. And in New York City, they're estimating based on their models that they could need as many as 30,000. And so the problem that we're going to have is that the numbers that are just coming out of the CDC right now demonstrate that about 48% of all hospital admissions are between 20 and 64-year-olds. And this is just my projection. I believe this is what's really happening is that you have a population of people basically from 20 to 90 that are all getting sick. A significant number of them are needing to go to the hospital. A significant number of them are needing oxygen. But people that start out sicker don't have kind of the stamina, if you will, to make it to the end of their treatment and survive. And that's why older people are dying. But there's still a lot of young people, I believe, based on things I'm seeing, that are going to the hospital that still need oxygen, and a few of them still need intubation. And so over in Italy, what you're seeing is they're prioritizing for the younger people because they believe that they'll survive. And some of the older people are just having a really hard time getting care in today's medical world over in Italy.
Yeah. And one of the things that we heard early on is like, oh, if you're younger than 60 or 50, you really have nothing to worry about. But now we're realizing that it's absolutely not true. And even 20-year-olds or 30-year-olds could be needing treatment and being hooked up to oxygen machines, just like older people.
Yeah, and I think the messaging is going to change. I think what they're going to eventually have to say is every population at every age is susceptible to this. However, if medical care is available, young people are more likely to survive it than older people, but certainly a significant number of young people will die if medical care isn't available to them. I think that, sometimes the facts, you have to be careful how you present the facts because it can create a picture that isn't completely in line with reality. And I feel that's a little bit what's going on right now.
Is there a way of, so for example, you mentioned New York, right? What if in New York, the situation is a big shortage, but then in New Jersey or Connecticut, they have a higher capacity? Is there a way to either transport patients or equipment to where it's needed, where there is extra capacity?
Yeah, you could certainly transport either patients or equipment. My feeling about this, though, is that each state in the United States is almost like a country in Europe. And I can't help but believe that each individual state is probably going to have concerns about shipping their equipment over to other states because people that are put on ventilators for this disease are often on them for weeks. And as we've seen, I mean, just in the United States in the past 7 to 10 days, our situation has completely changed. Italy's situation in the last 7 to 10 days has changed. And I think that it's likely that most people that have equipment are going to be very, reluctant to loan it to other people for fear that they may need it and not be able to serve their own population.
Sure.
So, I mean, we'll kind of see where that goes. I mean, it's normally that's how it works, but these are not really normal times. And so it's so hard to predict, the dynamic of how care is going to be delivered, going forward from here. So.
Do we have any idea why some outbreaks have been in areas that you wouldn't think they would happen? For example, in Italy, in northern Italy, where it's more rural, and I'd expect Rome to be the center of an outbreak.
It's really hard for me to comment on that because I've been to Venice in Italy, but I don't know much about Italy. Some of the distribution you're seeing here in the United States, however, is a little bit odd. Like we have a lot of family in Colorado, and just last night we got a call from one of our family members that was telling us about a situation up in Telluride where they are having a tremendous number of young people, less than 4 years old, that have been coming into the ER with acute shortness of breath that are presumed COVID-19 positive based on their symptoms and imaging. And we'll see if that's true. But why Telluride, Colorado, of all places, is having an outbreak? I mean, I guess it's ski season and there's a lot of people in and out, but that's a relatively small community. But I don't know if you've been following the numbers, but like today alone, thus far since midnight, they've reported 4,030 new cases here in the United States alone. So that brings us to a total of, I think, about 14,000. So you can see, I mean, that's a tremendous increase. And I think a lot of that increase is actually increased testing, not necessarily that it's growing that fast. But, as a healthcare professional, I'll tell you the picture that is developing is very scary. And if you talk to a lot of doctors on the ground, I mean, a lot of people are extremely concerned about the situation that's happening here right now and being able to actually deliver care for, an extended period of time.
Mm, absolutely. And it looks like in the States, we're still in that earlier phases where not as many people are reaching hospital as we're going to see in the next stages. So it's also very scary to think about. And what you mentioned about with testing, I know that in Colorado, for example, so far it's been very hard to get tested. They've had only a few drive-up testing stations, and then even those, you need a note from your doctor in order to get there. And I think they had about 100 a day for the days they were operating, and they were closed.
Mm-hmm.
So you're only testing people who are getting to the hospital.
Right. And the projections I've seen based on other countries is that the actual rate of infection is 10 to 50 times greater. So to put that in perspective, 10 times
Mm-hmm.
13,000 is 130,000. 50
Mm-hmm.
times puts us, more around 750,000 infections. And most of the data we're seeing is that 20% of all people that become infected are requiring some degree of supportive therapy in a hospital. So you can quickly see why this is a huge problem. And both
What
Jackie and I,
percentage again?
20%. Yeah.
20%. Wow.
Yeah. 15% are requiring oxygen therapy. These are rough numbers. I think it was like 18.9, but 15% are requiring oxygen and 5% are requiring full on ICU care. And obviously you and I, are part of an entrepreneur group. That's where we met. And if you've been following the thread, I've been very proactive when people are saying this is nothing, like, pointing to the numbers and say, guys, you just don't realize yet how much of a something this is. But 7 days from now, 10 days from now, you're going to see this in a very different light. In fact, I had a post from 7 days ago that I've posted a couple times where I laid out what I thought, and people at the time, they're like, that's ridiculous. They're not going to close our borders. They're not going to do this. And I'm like, just look at Europe. It's a preview for
Mm-hmm.
exactly what we're going to do here, because that's what's being tried. That's what's working there. And we're just going to, go lockstep and follow right down that pathway. So,
Yeah, yeah. It's I think almost every person that is I've talked to has had some sort of aha moment where they realize, okay, this is real, this is happening, and every day the situation keeps evolving, and we need to adjust our expectations and to see what's happening and let go of things we thought about in the past.
right.
For me, it was Wednesday of last week.
Mm-hmm.
I was hearing from Israel. I was supposed to go there for a wedding, and and then I hear about the travel bans and all the measures that are happening, and also seeing how many cases are still happening even after the government is taking proactive steps. And then I realized, okay, this is definitely coming here big time.
Yeah. And I mean, I remember I had the exact same experience. So I was actually out of town working, and I don't remember how long ago this was. I was kind of concerned. I had some friends asking me about this, coronavirus thing in China. And I was like, well, we've seen SARS and we've seen Ebola, and, it hasn't really impacted us. But the aha moment came for me. I was at work and I was going through the news, and I saw it was pictures from a store in Lombardy in northern Italy, and they were showing shelves emptied out of food. And this was before the big crush on the hospitals. And I was like, oh, this is not China panic. This is, European panic, and we are very similar to Europe. And then I started thinking about it. I was like, wait a sec, we've got 50 cases reported, but we haven't shut off the borders to everywhere. I'm like, there has to be an embedded population of shadow infected that we know it can take up to 2 weeks. This is at some point in time going to blow up on us. Unfortunately, I didn't short the market. I should have bought a bunch of puts then because the market was at like 28,000, but I was still kind of in denial. But
Mm-hmm.
but certainly, I mean, same thing. And I think that's what you're seeing is throughout the entire United States right now, people at different phases are having their aha moment. And when we hit critical mass that enough people are on board with it, that's when we're going to see the entire country is locked down and we just follow, Italy or Spain's, model that they have. So,
Absolutely, absolutely. And as you've mentioned, this is something we're going to be in for the foreseeable future. We don't know how long, At minimum, based on what we're seeing in China, it's at least 2 to 3 months if everything works as planned. If not, we can definitely see this for longer. And as you mentioned before, even once the numbers go down, and even if there are no new cases reported for a few days, it's very, very dangerous to go back and open things back up, because as you mentioned, things can flare up just as easily very, very fast.
Yeah.
Do you have any idea of what could be a good way of getting back to normal after we hit the peak and contain?
I've actually thought about this a tremendous amount, and the short answer is I have no idea. I mean, the only thing I can think of is that we, maybe go on full quarantine, and then we exercise extreme social distancing for an extremely long period of time, like on the order of like a year and a half to 2 years. So that's
until a vaccine comes available.
Yeah, until a vaccine becomes available, and we can, fight this from an immunologic perspective. But, well, David, I really want to thank you for your time today. I think it was very informative, and I like hearing different people's perspectives that have, especially a worldview, because I think right now it's so important to see what's going on around the world and to try to learn from other people and not have to figure this out on our own and make the same mistakes other countries have made. Some of it we've done good, some of it we've done bad, but certainly, there's a lot to learn, and, I wish you and your family the best, and stay safe.
Thank you, Gilman.
All right. Have a good day.
Bye-bye, you too.
Bye. Thank you for listening to the Gilman-Woolsey podcast. We hope you enjoyed our show. As always, if you have information that you would like to share with us, or if you would like to come on our show, please contact us at COVID at gilmanwoolsey.com. We're always looking for new perspectives and to get an idea of what's going on out there. Thank you. Have a good night and be safe.